Welcome back to my channel, and if you are visiting for the first time, you're also highly welcome. In this channel, we simplify anatomy, and here we also learn anatomy with so much fun. I'll be looking at the second series in the small intestine, and this will be the jejunum and the ileum. If you've not checked the first lecture series of the small intestine, which is on duodenum, please kindly go and do so as to keep yourself updated. I would be limiting this lecture to just the jejunum and the ileum. The jejunum and the ileum are the second and the third part of the small intestine. The first region of the small intestine is the duodenum. This is the duodenum highlighted in red, the region that begins immediately after the terminal region of the stomach. After the duodenum, the next region that is seen is the jejunum, and this is the jejunum highlighted in green, and this is followed with the terminal portion of the small intestine, which is the ileum, and this is the ileum that is highlighted in black. The ileum is the terminal region of the small intestine that finally opens up into the cecum. This is the cecum here, like a pouch. The next region of the large intestine is the ascending colon, the transverse colon, descending colon, the sigmoid, then the rectum and anal canal. And that is how the GIT finally terminates to the external environment. The jejunum and the ileum form the small intestine proper, which means that it is the main region of the small intestine. If you look at the entire length of the small intestine is about 6.5 meters. And out of this 6.5, 6 meters is taken up by the jejunum and the ileum, and it is why they are also referred to as the small intestine proper. The first segment of the small intestine, which is the duodenum, is about 25 centimeters in length. You can see how small the duodenum is, the region that is highlighted in red, while the bulk of the small intestine is taken up by the jejunum and the ileum, and this is why they are referred to as the small intestine proper. So this is the small intestine. The small intestine has 3 subregions, which include the duodenum. This is the duodenum here, which is about 25 centimeters. And from the 6.5 meters of the small intestine, 6 meters is taken up by the jejunum and the ileum, and that is why they are referred to as the small intestine proper. Also, the small intestine is seen to be intraperitoneal organ, which means that the entire surface of the small intestine is covered by the peritoneum. And this is also well represented in the jejunum and also the ileum. The jejunum and the ileum are intraperitoneal, and that is why we have the development of the mesentery that is used to connect these 2 organs to the posterior abdominal wall. This we would elaborate as we go further with this lecture. But in the duodenum, just the initial segment, that's about 2 centimeters of the initial segment of the duodenum is seen to be of intraperitoneal presentation, while the bulk of the duodenum is retroperitoneal presentation. You can also see that the intraperitoneal feature of the small intestine is also well represented in the small intestine proper, which include the jejunum and also the ileum. So let's drive a bit more on the jejunum. The jejunum is the second region of the small intestine, and this is the region that is highlighted in green. This region follows immediately after the duodenum. So this is the duodenum here, which is a C-shaped organ. After this duodenum, we have the jejunum, and the jejunum is about 2.5 meters in length. Also, the proximal 2/5 of the small intestine proper is the jejunum. And this is the jejunum here in the middle, or the second portion of the small intestine. The jejunum begins at the duodenojejunal flexure. This is the duodenojejunal flexure. There is a flexure, a bend that is seen around the region where the duodenum becomes continuous with the jejunum, and this is called the duodenojejunal flexure. This is the region that demarcates the beginning of the jejunum, and the jejunum finally terminates at the ileojejunal junction, and this is the ileojejunal junction. Just breaking down the name, as I've always said on this channel, if you have a name that has 2 composites, you break down the name for you to know what the word defines. So ileojejunal junction is the junction between the ileum and also the jejunum, and this is the point where the jejunum also terminates. Let's go back to the duodenojejunal junction, where we have the beginning of the jejunum, which is the flexure, a curvature that is created at the point where the duodenum becomes continuous with the jejunum. At this point, there is a ligament that is called the ligament of Treitz. The Treitz ligament is used to demarcate the beginning of the jejunum because it It is seen at the duodenojejunal flexure, and this is the Treitz ligament. This ligament connects the duodenojejunal flexure with the right cross of the diaphragm. This is the diaphragm highlighted in green, and the diaphragm helps to partition the thoracic from the abdominal cavity. We have the thoracic cavity up here, and inferior to this region is where we have the abdominal cavity. The thoracic and the abdominal cavities are not continuous, so they are separated by the diaphragm. So this diaphragm is what is highlighted in green, and this is the diaphragm here. So this flexure is where this ligament connects with the diaphragm, and the specific region of the diaphragm that it connects with is the right cross of the diaphragm. You can see it extending and going up to be inserted on the diaphragm. The Treitz ligament can also be further subdivided into two subregions. We have the superior or the upper skeletal muscular region, and this is the upper skeletal muscular region. And distally, we have the lower smooth muscular region. So this upper region is made up of skeletal muscle, while this lower region is made up of smooth muscle. And the point where this demarcation occurs is at the level of the celiac trunk. Remember our abdominal aorta, which is a continuation of the thoracic aorta. It pierces the diaphragm through the aortic hiatus, and as it enters into the abdominal cavity, there is an emergence of the celiac trunk, which supplies the GI tract organs. So the celiac trunk at this level is what demarcates the upper region of the Treitz ligament and the lower region of the Treitz ligament. And this ligament is made up of the upper skeletal region and the lower smooth muscle region. So the celiac trunk is the point of demarcation where this division occurs. So this is the Treitz ligament, helping to hold this flexure in place or connecting it to the right cross of the diaphragm, which is located above. That is giving it structural support or alignment so that digested food particles are being able to move freely between the duodenum and also the jejunum. This is helping to align the lumen of the duodenum with the jejunum so that food particles are able to move freely from the duodenum down to the jejunum. This Treitz ligament, we already know that it extends from the right cross of the diaphragm up here. As it descends down, it may also be seen to extend to be inserted on the third horizontal and the fourth ascending part of the duodenum. And where it does this, you see that the inferior smooth part will present a pronounced triangular expansion. So you see it extending to the fourth ascending part and the third horizontal part. So apart from being connected to the duodenojejunal flexure, you may also see it extending to the third and the fourth region of the duodenum. Also in the jejunum, majority of nutrients are absorbed. In the jejunum, we have the absorption of vitamins, minerals, carbohydrate, fat, and also proteins. So majority of the absorption of nutrients occur in the jejunum. So let's drive into the ileum. The ileum, we already said that is the final terminal portion of the small intestine. And it is this portion that finally empties into the large intestine. It is the longest region and is about 3.5 meters in length. It also takes about the distal 3/5 of the portion of the small intestine proper. We already said that the small intestine proper is made up of the jejunum and also the ileum. So the distal 3/5 of this region is taken up by the ileum. And this is the ileum highlighted in black, which finally empties into the cecum, which is the initial segment of the large intestine. And this begins at the ileojejunal junction. This is the ileojejunal junction, the junction between the ileum and also the jejunum, and also finally terminates at the ileocecal junction. This is the ileocecal junction, the junction between the ileum and also the cecum, which is the initial segment of the large intestine. And this is the cecum. In the ileum, we have the absorption of specific nutrients, which include vitamin B12 and also bile acid. So there are specific nutrients that are absorbed within the ileum. Remember that we say in the jejunum, majority of nutrients are absorbed in the jejunum, while in the ileum, there are specific nutrients absorbed in this region. So let's go to the mesentery. How is the mesentery developed from the small intestine proper, which includes the jejunum and the ileum? We already said that the jejunum and the ileum are intraperitoneal organs. And because they are intraperitoneal organs, there's going to be the development of mesentery. So let's see how this mesentery develops, because we say that this mesentery are used to connect these organs to the posterior abdominal wall. So from the intraperitoneal covering, let's say this is the organ highlighted in red. And we said that for intraperitoneal, from the name intra, it means it is embedded within the peritoneum. It also means the entire surfaces are all covered by peritoneum. So you see the peritoneum highlighted in blue, and you see it lining the entire surface of this organ. And because it is lining it, one layer is connected here and the other layer is connected here. And at this space, you have the two layers of peritoneum, which is a double layered structure. And this emerges and of course runs a distance. And this emergence is what is called the mesentery. And this mesentery is what is used to connect this organ that is highlighted in red to the body wall. So in the jejunum and the ileum, it helps to connect it to the posterior abdominal wall. This is where we have the mesentery here emerging as a double layer of peritoneum. And in this image down here, this is where we have the mesentery. You can see the mesentery emerging after covering the entire surface of the jejunum and the ileum. You now see it connecting to the posterior abdominal wall. So it is through this mesentery that is harrowed in white that the jejunum and the ileum are also connected to the posterior abdominal wall. So this double fold of peritoneum, apart from giving this organ structural support by helping to connect it to the posterior abdominal wall, it also helps to store fats, because if these fats are stored within the organ, it's going to reduce the lumen. Instead of being deposited on the organs, they are being deposited on the mesentery. So it's helping to also hold the fat that are supposed to be deposited on the organs. Also, this mesentery creates passageway or conduit through which vessels reach this organ. If you use this image up here, within the mesentery, you have the passage of vessels, and these vessels will finally terminate to supply this organ, helping to create a conduit for the passage of vessels, which include artery, veins, nerves, and also lymphatics. Blood supply. The blood supply of the jejunum and the ileum is from the superior mesenteric artery. These organs are organs of the midgut, and we know that the organs that are developed from the midgut are supplied by branches from the superior mesenteric artery. The superior mesenteric artery is a branch of the abdominal aorta. So let's say this is the abdominal aorta highlighted in yellow, and on the abdominal aorta in the anterior surface, below the emergence of the celiac trunk above, we have the superior mesenteric artery. This is the superior mesenteric artery highlighted in blue. So the superior mesenteric artery then gives off jejunal and ileal branches, and this is about 15 to 18 of these branches that emerges from the superior mesenteric artery, and these are the branches. And that is how they go and driven towards the jejunum and the ileum to supply it with oxygen and nutrients. We also have the emergence of the ileocolic artery. The ileocolic artery is the most inferior branch of the superior mesenteric artery, and where this artery supplies is the distal region of the ileum. So the distal portion of the ileum is where the ileocolic artery supplies. So there is a pattern by which these arteries, after their emergence, the anastomose around the mesentery before they are finally terminated to supply the jejunum and the ileum. So let's dive into this to see how this anastomosis occur. They form the arterial arcades. These are the arterial arcades. After they originate from the superior mesenteric artery, and you see them tailing towards the jejunum and the ileum within the mesentery, the arterial arcades are arc-like anastomoses created by the jejunal and the ileal arteries. At this region, they form a form of arc within the mesentery, and this is called the arterial arcades. These arterial arcades are formed here, and if you look at in the ileum, we also have the arterial arcades formed as harrowed in this image. After the formation of this arterial arcades, there is now the termination of straight vessels that finally goes directly to supply the jejunum and the ileum, and these are called the vasa recta. So from the arcades, which are arc-like configuration of vessels, we have a final termination that is called the vasa recta, and these are straight vessels. You see them, they finally terminate from the arterial arcades to now supply the jejunum and the ileum, and that is what is also presented in the mesentery of the ileum here. So you have the final termination from the arcades, and these are called the vasa recta. So that is how they finally terminate to supply the jejunum and the ileum. You can see the specificity that is created by the jejunal and the ileal artery within the mesentery. And we already said that the mesentery also creates like a conduit through which vessels pass through before they finally supply the jejunum and also the ileum. So the venous drainage is the superior mesenteric vein. We know that the arterial supply is the superior mesenteric artery. So the corresponding named vein is also the venous drainage of the jejunum and also the ileum. The lymphatic is supplied by the mesenteric lymph nodes. Then the innervation, for sympathetic innervation, we have the thoracic spinal nerves, and this ranges from T9 to T10 spinal nerves. For parasympathetic innervation, we have the vagus nerve. So let's look at the differences between the jejunum and the ileum, even though there is no line of demarcation between these two organs. However, there are some differences created between these two organs for medical practitioners. So for anatomists and also surgeons, there are distinct characteristics that are presented by the jejunum and the ileum, and this can be used to differentiate these two organs. So let's dive in to see the differences seen or presented by the jejunum and also the ileum. So the first difference is that the jejunum is thicker in wall and also more muscular. If you look at the wall of the jejunum, you see that it is thicker and also muscular. This is the wall of the jejunum and this is the wall of the ileum. This is thicker than what is presented in this image and also more muscular. Then the second difference is that the lumen of the jejunum is wider than the lumen of the ileum. This is the central lumen of the jejunum. You can see that it appears to be wider. If you check the diameter of this lumen, you see that it is more than what is presented in the ileum. And the ileum, of course, has a smaller lumen when compared with the jejunum. The lumen of the jejunum is about 4 cm, while the lumen of the ileum is about 3.5 cm. The jejunum also has longer and closely packed circular folds, which are the plica circularis. These circular folds in the jejunum, these are the circular folds in the jejunum, and these folds, you see that they appear to be longer and they're also more closely packed. If you look at the ileum, they are shorter and they are loosely packed. And this is the circular folds that is presented within the internal wall of the jejunum, and you can see that there is the creation of more infoldings within the mucosal wall of the jejunum. And the ileum, you see that they are less pronounced here. The infoldings that is created by the ileum is not as much as what is seen in the jejunum. And this is because the circular folds are closely packed here, while here they are loosely packed. Also going further, another difference between them is that they have about 2 rows of arterial arcades. Remember when we talked about the blood supply of the jejunum and the ileum and the pattern by which these anastomosis are presented? We said that the jejunal and the iliac artery presents arterial arcades. This arterial arcade in the jejunum is about 2 rows, and this is what is seen here. For the ileum is about 4 rows. So if you count this, you see that it's about 4 rows. And what this leads to is that in the jejunum, the final terminal or straight vessels that will now emerge after the formation of the arterial arcades will tend to be longer, and that is what is seen in the jejunum. In the ileum, because of the creation of more arterial arcades, the final terminal branch that is called vasa recta will then be shorter. So if you look at the mesentery and look at the pattern of anastomosis that is created by the jejunal and the iliac artery, you will also be able to differentiate if this is the region of the jejunum or this is the region of the ileum, considering the number of rows of arterial arcades created and also the length of the vasa recta. Then the ileum, if you look at the mesentery of the ileum, it has more deposition of fat. This is the ileum here, and these fats are represented in dots, while in the jejunum we have less deposition of fat. And what this causes is that the peritoneal window will be seen to be opaque. It will be seen to be opaque because of the blockage that is created by the fat deposit. The peritoneal window are spaces that are created by the final terminal branches from the arterial arcades, which are the vasa recta. So the spaces between this region are called the peritoneal windows, and these windows will appear to be opaque. And this means that looking at structures in the posterior abdominal wall will not be easily visible because of opaque nature that is created by the fat deposit in the mesentery. And if you look at the jejunum, you see that they appear to be translucent. And translucent means that you can see the posterior abdominal wall through the peritoneal window. We already said that the peritoneal window are spaces that are created between the vasa recta. Also, the jejunum has more numerous, longer, thicker, and also leaf-like villi. These are the villi, which are the infoldings that are created within the mucosal lining of the jejunum. And if you look at it, they are finger-like. If you look at it, they are thicker, they are longer, and they're also more numerous. These are the villi here in the jejunum. In the ileum, They are less in number, they are shorter, thinner, and also they are finger-like. This can be used to justify the absorption of the jejunum and also the ileum. Remember, in the jejunum, we said that majority of nutrients are absorbed within the jejunum, and the creation of these infodins is to increase the surface area for absorption. And you can see that in the jejunum, they are more in number, they are thicker, they are also more pronounced and longer. But if you look at the ileum, because we said that specific nutrients are absorbed within this region, so the infodins are not as pronounced as what is seen in the jejunum, and that is why they are less in number, they are shorter, and they are also thinner. So you can compare these differences and also use it to justify the functions that they exhibit. Also, going further, in the ileum, we have Peyer's patches. Peyer's patches are collection or aggregation of lymph follicles. These lymph follicles are of immune function. And within the ileum, this is the ileum highlighted in red here. You see that we have aggregate or collection of lymphoid follicles. And this is what is highlighted in black. They are collected together. While in the jejunum, they are seen as solitary lymph follicles. And that is why you see that they are scattered within the mucous membrane of the jejunum. So you see the lymph follicles scattered here, while in the ileum, they are seen to be collected together. And these are called the Peyer's patches. So let's check our understanding of this lecture through the following question. And the first one is, mesentery of the small intestine is formed from intraperitoneal covering. Explain. And the second question is to describe the anastomosis created by the jejunal and also the iliac artery. This we have adequately explained in this lecture through the creation of arterial arcades and also vasa recta. Then the last question is to highlight the differences between the jejunum and also the ileum. So thanks for watching this video. Let's meet again.